I'm Elena Nevels, and my evidence-based practice project was at Baptist Health Lexington in the Cardiac Intensive Care Unit. The problem was smoking cessation in the cardiac population and the staff's knowledge of how to tailor interventions according to their stage of quitting on the trans-theoretical model. According to the CDC, 1 out of every 4 deaths is caused by heart disease. Smoking is one of the biggest risk factors for heart disease, and it also causes 1 out of every 5 deaths in the United States each year. 8 of the studies were reviewed to show significance of added interventions for smoking cessation. The target audience was the cardiac intensive care unit staff. The purpose was to increase the staff's knowledge to assess the patient's readiness to quit, provide resources for smoking cessation, and educate about the trans-theoretical model with tailored interventions. In the literature review, all the studies used added interventions beyond the usual smoking cessation programs. 7 of the studies were experimental, 1 was qualitative. In the qualitative study, it kind of showed me the perspective of both the patient and the staff, so it kind of gave a different perspective. Studies used face-to-face counseling, telephone counseling, nicotine replacement therapy, and internet counseling, all with positive outcomes for added interventions. 5 of the studies used the trans-theoretical model with positive outcomes for smoking cessation. In the implementation of the project, IRB was applied to. I got IRB Director, Instructor, and Vice President approval. A PowerPoint was presented at a staff meeting, and they were educated about the 5 A's with every patient assessment. One study suggested that with every patient encounter, use the 5 A's of intervention. Ask about smoking, how long, how often, how much, which we do that anyway. Advise, educate the patient about the health consequences and the potential benefits of quitting. Assess, use the trans-theoretical model to determine a patient's readiness to quit and ask about their motivation to quit. Assist, help the patient establish a stop date, their triggers, provide resources. Arrange, contact other hospital resources like the discharge planner, case management to arrange for counseling sessions or to provide access to peer support groups. They were also educated about the 6 stages of change of the trans-theoretical model. Stage 1 is the pre-contemplation. The patient still smokes. They don't have a plan to quit within the next 6 months, so the nurses encouraged us to ask about smoking with every patient encounter because they're not open to change. Stage 2 is the contemplation stage. They still smoke, but they're considering quitting within the next 6 months. The nurse is encouraged to provide smoking cessation aids like nicotine replacement therapy, counseling, support groups. Stage 3 is the preparation stage. They still smoke, they're considering change within the next month, so the nurse needs to assist the patient with planning a stop smoking date. Pharmacotherapy should be provided and encouraged. Follow-up care should be implemented like counseling, self-help groups, peer groups, websites. Stage 4 is the action stage. They haven't smoked for up to 6 months, but they're at increased risk for relapse in this stage, so the nurse needs to realize that follow-up care is very, very important. Relapse triggers should be addressed and avoided. Pharmacotherapy should be encouraged. Outside resources should be provided. Stage 5 is the maintenance stage. They haven't smoked for 6 months or longer. Their confidence level is high. The nurse should encourage them to take a leadership role, like help other people quit smoking, keep doing the pharmacotherapy. Stage 6 is the relapse or termination, so the patient may both relapse and regress to a previous stage, or they will be smoke-free. So the nurse should encourage them to keep doing what they were doing to stay smoke-free, or the nurse should provide interventions according to the stage that they relapse to. Staff were also educated about potential resources to provide to patients. Pharmacotherapy like nicotine patches, gum, PO medicines like Chantix. Counseling, the nurse should provide counseling, research and find like counseling centers in the patient's area where they live. Family and or peer support is important. Smoking cessation classes, a lot of hospitals offer this. Hospital resources like pamphlets. Provide patients with resources outside of the hospital like websites, peer groups that they can go meet at. Some insurances provide services that support counseling for smoking cessation, so that's a good idea. Recommended websites, smokefree.gov, cdc.gov, helpguide.org. Those are all good websites. Overall, the staff was very receptive to the interventions. They all felt like they don't use added interventions. They just ask patients if they smoke, and that's about it. So they were all excited about this. Some of the negative aspects of the project, not enough time, of course, and I needed to assess staff knowledge before and after the education. So that would be something to consider in future studies. Overall, I really enjoyed doing this project. If anyone has any questions, just send me a comment. Thank you so much for listening.